So welcome everyone. This really is a very special support group leader conference call. It's in addition to our quarterly calls because we're all living through a very challenging time right now. And Susie and Dr. Durie really wanted to reach out to find out what your challenges and concerns and questions are. So that's what the focus is going to be tonight. And I am going to turn the call now to Susie to give some words of wisdom.
Thank you, Robin. Well, hello to all of you wonderful, caring, and very resilient support group leaders. You are truly amazing, and I know how much you put your heart and soul into all that you're doing, helping others. And we're very grateful to have the opportunity to be together today, thanks to technology. These are very strange times for all of us. Our beautiful world seems to be under siege, but I know we'll come through this and we will win. As Peter Anton says, we are myeloma warriors and we'll get through this together. We are myeloma strong. And now it's my pleasure to turn it over to Dr. Durie. Brian?
Well, thank you, Susie. As you say, these are very difficult times. And it is a good timing to review questions and concerns that you all have about this COVID-19 coronavirus. And so thanks to many of you for answering the survey. 43 people actually answered the survey, some in quite a bit of detail. And so I had a chance to review all of those questions and concerns. And so if we go to slide number 1, COVID-19 basic information, it's important just to understand a little bit of the background of this novel coronavirus. For example, the D19, that refers to December 2019, when this coronavirus first emerged close to Wuhan in Hubei province in China. And that's where all this trouble began in late December into January. It turned out to be a highly infectious novel virus. It is predominantly spread by droplets which come from coughing and sneezing. However, we've learned that these droplets can hang around in the air and can land on surfaces. In the air, it's a little bit controversial how long do these droplets last in the air. The low estimate is probably for at least 30 minutes, but maybe as long as 2 or 3 hours. On surfaces, there seems little doubt that the droplets can persist on surfaces for quite a number of days, even a day or 2 or 3. Depending on the type of solid surface, the droplets can last longer on plastic as well as on metal. But the biggest risk for anyone is direct contact with a person who may be coughing or sneezing or may be transmitting the virus. And so I'm going to talk a little bit about that as I go through. If we go to slide number 2, what are the key recommendations? Well, obviously, the key recommendation is that you want to avoid that direct person-to-person contact. That is number 1. And so physical distancing. I've selected physical distancing versus social distancing because the key thing is that you want to be physically separate, at least 6 feet away from someone who may have the virus and may be coughing or sneezing or able to transmit the virus. However, obviously, as we are doing it right now, we still want
down every.
Excuse me?
I've muted the mic, Dr. Durie. Go ahead.
Oh, so sorry. By the way, I didn't emphasize, what I suggest is that, and we do want to take questions on this, but I think probably with this large group, the easiest will be to go through this short slide deck and then take follow-up questions at the end. But what I was saying is that we do want to very strongly maintain the social contact so that we're aware together, that we can support each other and be informed. However, it's the physical distancing that we need to avoid. We want to avoid contact with anyone who could be potentially infectious. The simplest way to do that is just to stay home. And I think that for myeloma patients, if there's any message to come from this today, it is please do your best to stay home all the time, or the vast majority of the time. Wash your hands if you come into contact with anyone or any groceries or things that may have been delivered to your home. We have a very nice video that we posted that has some suggestions about how you can deal with groceries that may have been delivered to your home, how to handle fruits and vegetables, how to handle canned goods and other types of things. And you just need to be aware to protect yourself from anyone who is an outside contact. So the delivery person can leave the materials on your doorstep and they can step away, and hopefully you'll be able to pay everything electronically, and then use these guidelines which are in the video that we have supplied. There is a lot of controversy about masks right now, but the truth of the matter is, if we did have access to masks, it probably is a good idea to use them. The masks mostly prevent the person who is coughing or sneezing from transmitting the virus to someone else. So mostly for the person who's wearing the mask, it prevents them from transmitting the infection to someone else. And so for a delivery person, it would be very good if that delivery person is wearing a mask, and if they're not, you should stand well clear. If we go to slide number 3, a very, very important point for you and your family and your friends is that the risk of becoming infected seems to be pretty much equal for everyone. This is a very, very infectious virus. It's 3 to 5 times more infectious than the flu, for example. So the idea is that pretty much anyone can catch this infection, and you've seen very many prominent people in the news, as well as younger people, very healthy people, getting infected with this virus. And so there is a high risk of catching the infection if you encounter the virus, particularly if you encounter someone who is infected and might be either coughing or sneezing, or maybe has produced droplets onto surfaces that you might come in contact with. And so the key point beyond that is really, if someone does contract the COVID-19 infection, what are the factors that indicate that there could possibly be serious consequences? And this is the most important thing for myeloma patients to be aware of, and for you guys to be aware of for your support group members. And the key thing here is that a high virus load from work is the main thing. Medical professionals and people who have a lot of public contact are the people who actually have the highest risk of infection. What has been realized recently is that in the medical setting, especially in an environment where oxygen is being provided to patients, the provision of the oxygen actually aerosolizes the infectious droplets. And this is something that is so dangerous for medical professionals who absolutely have to be wearing these N95 masks and the proper PPE, the protective equipment. Very, very important. And this is important for you to be aware of, because if you go into the clinic and have to work with a nurse or a doctor, you really need to be so cautious, and they need to be protected to have any interactions with you. Beyond that, for the average person, being older is definitely a risk of potentially serious consequences. For some reason, men seem to be more likely to have serious events, but the main medical risk factors are, in fact, high blood pressure, kidney disease. It seems linked to chronic high blood pressure, and or sugar diabetes. In the U.S., in the case report from Washington State, they just reported the first 23 patients, many of whom came from the Kirkland nursing home. Those cases were just reported in the New England Journal of Medicine, and about half of those patients had very serious consequences. And of those patients, about a quarter of them had high blood pressure or problems related to that, and another quarter of them had diabetes, and a majority of them were actually over the age of 65. And so those are key things that seem to lead into having important complications. What we are obviously most concerned about is, what about someone with a compromised immune system or some other types of comorbidities? And I'm going to talk a little bit about that now. So what are the specific risks for myeloma patients? And let me just comment that patients who have MGUS and smoldering myeloma do have some compromised immunity, although not to the same extent of a patient with active myeloma. And so patients with MGUS and smoldering myeloma still do need to be somewhat cautious. However, having myeloma is really not the top risk group, which I discussed on the previous slide. And something that I learned from working with all of the key opinion leaders in Asia who work in our Asia Myeloma Network, we are conducting myeloma trials. We have 8, 9, 10 trials going on with different novel agents throughout Asia. And what they told me is that in Asia, there have been no deaths among myeloma patients in Asia. They have been using strict precautions in working with the myeloma patients. As you have probably been aware, looking at the news, in Asia, wearing masks is the normal thing. Protecting against infection is a very, very strict thing in Asia as a normal course of practice. And it seems that this has been quite important in reducing the exposure to the COVID-19 in Asia and any serious complications. In fact, I was unable to find a patient who had even tested positive in Asia with myeloma. That included China. Even we were in touch with the director of the Central Hospital in Wuhan, China, and he said the patients with hematologic malignancies, including myeloma, were not among the risk groups at their hospital. And so it's a concern, but strangely enough, it was not the primary concern that they were experiencing. But there nonetheless are very important risks that myeloma patients need to be aware of, linked mostly to what is the status of your myeloma, what treatments are you taking, and what is your need for contact with your myeloma treatment center, with your doctor. And so key points to allow you to stay home are: use telemedicine. And so this is on slide number 5, the specific risks for myeloma patients. Call your doctor's office. If you have email contact, use that. Access your lab if you have your access code to the electronic lab files. Use all of those methods to keep track of your myeloma and get recommendations from your doctor. And really limit the clinic visits. And I'm going to get into that a little bit with what are some very specific suggestions to limit those clinic visits. And then, to the extent that you can, get your refills delivered. BMS Celgene have said that they're willing, and that this is even within our trials, to have Revlimid delivered directly. And if you do need to go into the clinic, really insist in knowing, well, which office will they see you in? Is it an office which is a little bit away from maybe the main hospital where they might have COVID-19 infected patients? And What about the staff? Will they really be using PPE, masks, etc.? It's very, very important for you to be aware of that. If we go to slide number 6, what are the situations where a myeloma patient might need to be especially cautious? Well, at the time of initial diagnosis for the first 3 months, this is definitely an unstable time and a time where the patient might indeed need to be going into the clinic and to be especially cautious. And this is also a time where right now preventative antibiotics would be recommended to use something like Biaxin or Cipro along with acyclovir just to be protected during those initial treatment periods. But this is also a time to be in close contact with your doctor and to work through this very, very carefully. In terms of autologous stem cell transplant, this is absolutely not the time to move forward with that. And so this is something, again, to be discussed with the doctor to delay that. The initial therapy can be continued for another month or 2 right now, and that would be the smart thing to do. If you're concerned about harvesting and the ongoing use of Revlimid, possibly the Revlimid could be switched to Cytoxan, cyclophosphamide by mouth. If you're concerned about the suppression of the stem cells for the harvesting process. So there are a number of things that could be adjusted to keep all the options open, but just to avoid the risk right now. If a patient has recently relapsed, again, this is a tricky situation. Clinical trials are not accruing right now, and it's going to be important to find a combination of recently approved novel agents that can be used. For example, just to give you an example, I recently recommended a patient to use the combination of selinexor plus Ninlaro, 2 agents by mouth, versus using, for example, Velcade or Kyprolis, so that a combination of the selinexor with a proteasome inhibitor was feasible in a safe way, reducing the number of visits to the clinic. So just to work through those things with the doctor. And of course, as you might imagine, if you've achieved a very good partial response or a complete remission, and you're ongoing on maintenance or even off maintenance, this is a much, much lower risk situation. If we look at the risk factors related to the logistics of care, and there were a lot of questions about this. How do I manage my myeloma right now? And so if you do need to go into the center, as I've said, make sure that a visit to the center is safe, where there's use of masks and hopefully protective equipment. Talk to your doctor about treatment changes. Right now, it's very safe to say, okay, let's skip that Zometa infusion for 1 or 2 months, because truthfully, if your myeloma has come into remission, that is not an urgent need at this time. For daratumumab, if this is being used as part of a new treatment, it may be necessary to continue that. However, in the maintenance phase, it may be possible in discussion with the doctor to reduce the number of infusions, maybe once a month as part of the maintenance. For dexamethasone, it's not a good time to be taking a high dose, and so if feasible, talk to the doctor about using a lower dose or possibly even eliminating that dex for now. It can mask infection and can also make more active infection more likely. So pay attention to the dose of the dex. As far as maintenance, I actually recommend generally that the maintenance be continued. It's important to keep your myeloma in remission, and strangely enough, a lot of our myeloma therapies are actually active against viruses or are anti-inflammatory. So Revlimid and pomalidomide, these are actually anti-inflammatory. They're immune modulating agents. and they could conceivably even be beneficial. And also the proteasome inhibitors, Velcade, carfilzomib, these are actually kind of antiviral type agents, and there's even a couple of studies going on right now to evaluate that. And so actually, provided that you're tolerating the maintenance and it can be administered in a feasible way right now, I'm okay for that to be continued. Be cautious about the dose and schedule. If the white count has had a tendency to drop, I would suggest reducing the dose of the maintenance or changing the schedule so that you avoid any low white blood cell count. This is not the time to be having that happen. If we go to slide number 8, additional logistics, it is important to remember that vitamin D deficiency is pretty common in myeloma. Vitamin D is one of the things that is helpful to fight off virus infections, and so please don't forget to maintain your additional vitamin D3 if that has been used to boost your vitamin D level. Someone asked about the immune properties of shiitake mushrooms. Well, I think that there is an immune boosting effect from those, but certainly not anything that anyone would want to rely on at these kind of dangerous times. Clinical trials, the main thing to be aware of here is that both the local hospital and center IRBs are very, very open to modify the trial to make it more feasible for you. And the FDA has published guidelines to the investigators like myself so that we are able to modify the protocol during these very, very difficult times so that you can stay on the study and stay as safe as possible. So please talk to your doctor about that, because I'm sure that you can get your lab tests done locally, and that you can even get some of the infusions done locally, possibly, if that's easier and safer. There are quite a number of options for getting lab tests done right now. For example, I just give you this as an example. The LabCorp Corporation, this is a big lab testing group. They will even have you, it's kind of like a drive-up lab testing possibility. So check into some local or safe ways to get your lab testing done. So in the big picture, we are all really, really worried about how this is all going to play out for all of us. And there are some things I summarize on slide number 9. It does seem now that the COVID-19 infection is being transmitted from patients with early disease who do not have symptoms. And so we all just need to be so careful with our contacts. You have to assume that people that you encounter could possibly have the infection. So we just need to be all so safe. Because we don't have testing available broadly right now, we frankly just don't know. One very, very helpful thing was noted recently from several countries, actually, is that one of the first things to happen with COVID-19 infection is extreme loss of smell. People say that they can't distinguish between water and wine. They can't distinguish the smell of anything. And it's a very, very strange and characteristic feature, and what I would call a telltale sign of possible infection. And there may be a lack of the classic features such as fever, which can be masked by the use of steroids, and the cough initially may not be that remarkable. Some patients have been reporting that they don't have those respiratory symptoms. They may even have some GI type symptoms, even with some diarrhea. 10–15% of patients have been reporting that that is what actually happened first. But what a majority that I'm aware of have been reporting is that they have this really strange, diffuse, quite severe aches and pains around all the joints in their body, in the shoulders and in the back and around the hips. And so that is a very, very important telltale sign in yourself, or possibly in family and friends, to be alert to. So if we go to slide number 10, we do need to pay attention to our family and friends. So be alert to anyone in the group who might have infection, and it may be in some homes there has had to be self-isolation within the family, where someone has got to stay in their room, and you need to stay apart from someone within the family group, and this physical distancing may be required. In this circumstance, obviously, it would be most helpful if testing could be done, and wearing masks, getting testing. I mean, I favor both of those things to really understand what's going on. So if we move to slide number 11, I think that we are all anxious. And as Susie and Robin said at the beginning, we are all sticking together, trying to understand this and being strong and fostering our resilience to get through this. We will get through this. All these storms pass. By the latter part of the year, we will be looking back on that. And it's so important to maintain our social connections right now, despite the physical distancing, and whatever we need to do that is important. And I know that Robin and John will be going through some details about the go-to webinars and Zooms, which can be used a lot. And please just remember that everyone in the family gets anxious. When you're anxious, people around you are also getting very, very anxious. And so we all need to stick together and try to reassure each other and try to recognize what can be a way forward that is positive and helpful. And so if we go to slide number 12, I think it's important to look at, well, how do we expect it to play out right now? And there's a lot of conflicting information on the news, on those press briefings and the like. And I'm going to give my own interpretation in just a second here, but it is key to be aware that some treatments are moving forward. The malaria drug, hydrochloroquine and chloroquine, it's a medicine, the trade name is Plaquenil, and some of you may be familiar with that. It's used to treat rheumatoid arthritis. And also the use of plasma, which has antibodies from patients who have recovered from the COVID-19 infection. And these plasma treatments can work, and those would be usable for myeloma patients. And so that is an option potentially if anyone does get an infection. I think we need to be realistic that even with accelerated programs, a Manhattan-type project, vaccines are going to take a while, a minimum of 6 months, and that would be phenomenal, and more like a year to a year and a half, frankly. But it may be something that will become important in the longer term. These will not be live vaccines, and so I do believe they will be feasible for myeloma patients, and so I don't think we need to be alarmed about them, and maybe something that is going to be part of all of our futures. So if we go to my last slide before we're ready for open questions, what can we expect right now? Well, frankly, I think that we're moving into a period of April and May, continue to stay at home, and this is just so important for myeloma patients and their families. And just be aware that there may be further lockdowns. And so one thing to be aware of related to that is that you should stock up now rather than later. And that stocking up should not just be with groceries. It should be any kind of like ancillary medications that you might need. People are predicting already, saying that there's a lack of Tylenol. Any routine medications that you need, please get stocked up on things that you might be going to need in those coming weeks. I do think that the storm will pass mostly by June, hopefully, although I think it might be unlikely that there will be a whole lot of traveling happening then. I think that is unlikely to be the case until later into August and September, where we might have a degree of normality. And the longer term picture, we frankly, I don't think any of us know what that picture looks like. But I would say something just for everyone to be aware of. I do think that as we look to the future and to the fall, probably some sort of a certificate or a medical stamp will be required to show did you at some point test positive for COVID-19, and do you have and do you have an antibody test to show that you've recovered? And if you've not been infected, you may be asked to show that you have a negative test result. So anyway, these are some of my perspectives, and I know that these are extremely crazy times, and in all different parts of the country, you may have different perspectives and different concerns and questions and the like. But hopefully this has given you a kind of a broad perspective, sufficient to trigger some open issues, and hopefully I've been able to cover some of the major concerns. So I'm going to stop there. So thank you so much.
Thank you, Dr. Durie. That was really informative, and I hope everyone understands that these questions and challenges and concerns are based on the SurveyMonkey
Right.
responses that you all filled out, and so I think this broadly addresses your questions, but we know that there still are a lot of questions that could be out there, and you can either put in the chat box if you have a question, or you can open up your own mic and we can begin to take some questions.
It might be best so that everybody doesn't open their mic at first is to put your question in chat first, so then Robin can call on you, and then there's some sort of order in that way.
Okay, so I'm looking down in the chat box right now, and questions coming in from meeting room 14. It might be Nancy Bruno, and she's asking, can acyclovir help with defenses?
Can what help?
Acyclovir.
Oh, acyclovir. Yeah, I think that it's very good to. I don't think it specifically works against the COVID-19, unfortunately. However, it's very, very important to stay in good health and keep any like background virus infection, bacterial infection under control. And so, as I said, for newly diagnosed patients, for example, those preventative type antibiotics, I would recommend for the first 3 months, during those first 3 months of induction, for example, acyclovir and, as I said, Cipro or Biaxin or something. So yeah, those are good background type things to do to try to maintain the best conditions. Yeah.
Okay, great. I see a question, John. If I say whose line it is, could you find it and open their line? I have a question from Marilyn Alexander.
Yeah, they should be able to open their lines themselves.
Okay.
Marilyn?
Hi, Marilyn. How are you?
Hi, Dr. Durie. I'm presently on Velcade, and I was wondering what your thoughts were about me. I get my treatments at a cancer center, not in a hospital setting. And would that be continued to be safe for me to go there if I was masked and gloved?
I think so. That some of these separate centers, I think that where you go as a freestanding center, that's the Abramson Center, I think, right? And so, what most centers have done is they have special entrances, and they have really taken some very good precautions to limit the number of people that you would be in contact with. But I think it's good to call ahead and maybe go at a quieter time, for example. Just be the most cautious that you can. there's some idea that maybe you get the Velcade sub-Q, I think, that there may be some relax in rules and regulations which might even allow Velcade to be administered at home with a nurse, you know what I mean? And these are some things that we're exploring right now to see if permission might be granted for that.
Okay, thank you. I appreciate the time that you've spent to do this today for us all. We really appreciate you.
No worries. Thank you.
So we have a good question from Bonnie Falbo. Bonnie, can you open up your line?
Hello, Dr. Durie. Thank you so much for doing this.
No worries.
Okay, I'm not sure. I answered a couple of questions, so I'm not sure which one you were referring to. Which question?
Talk at 3 o'clock. You missed the whole damn thing.
Got someone else in the background,
Your
Bonnie.
mics are open and we can hear you.
Somebody else is talking
I
also.
was able to mute
Can you
them.
hear me?
Should be all set now.
So
Okay.
Bonnie,
I'm
I
not
think-
sure which question. Yeah.
Yeah, go ahead.
So Bonnie, go ahead. You had some questions.
I do have a few questions. One is
Okay.
about, and I see a lot of other people would still like further clarification about this mask issue.
Right.
And, you know, aerosol versus droplet and
Right.
what is it, inward transmission? So if we are protected by wearing either a surgical mask or an N95 mask from aerosol or droplet transmission, could you just say a little more about that?
Right. So obviously the starting point on this is the access to masks right now, and so you'll see a lot of this in the news actually today and moving forward. I think that it seems likely that the masks will be more broadly accessible. But the main thing about the masks are that they prevent the outward movement of the droplets. So in other words, if you're wearing a mask, then it prevents the droplets from moving outward. So if you're meeting someone who's wearing a mask, you're actually protected from the droplets coming towards you from that person, okay? Now, if you wear a mask, then you are also protected. You've probably seen, so the concerns about that are that you tend to be touching your mask and moving it around and then taking it off. And so then whatever on the outside of the mask, droplets or whatever, then they get on your fingers and then they can get on your face and things like that. And so that inward movement is not so secure, but nonetheless, on balance, does seem to be helpful, you know. But you're going to see a lot of discussion about this back and forth in these coming few days as maybe more masks become available. But the main thing is that if you meet a medical professional or other people, it's really good if they are wearing an N95 mask, which they certainly should be for their own protection, you know.
Well, my husband is on maintenance Revlimid, and just for example, right before COVID hit, his ANC was fluctuating, and they were trying to decide whether to adjust the dose and wanted him to do weekly labs. And at the laboratory that we go to, which is in a clinic building and nicely separated, the lab people are not even given surgical masks, and they're not allowed to wear them.
I know.
We offered them an N95, and they wouldn't even, they just said, I'm sorry, but we can't wear it. So he wore a P100 to get labs done. And
I know. It just this. I'm just so sorry. I mean, it's hard to explain how crazy this particular discussion is right now. And so, but in general, if we have access to masks, we should all be wearing them, is my opinion. But the other thing I would say is related to the weekly labs. I mean, we need to take practical solutions right now. So if the idea is that you want to cut back on the dose a little bit to reduce the risk of a low white blood cell count, you just need to go ahead and do that. You know what's been happening with the higher dose. Go ahead and reduce the dose, and you're probably going to be fine. You're certainly going to be better, right? And so we need to make these kind of pragmatic, practical decisions just to move in a good direction. And some of it is not going to be 100% to standard, you know, where, well, you know, what were the changes in the white cell count, like we might like to know, but it's probably more dangerous to find out than the fact that it's probably doing better than it was before, you know?
Right. And if may I ask one more question? This is just a general maintenance related question, but
Sure.
it's always talked about as if you have to be on a given dose of a medication,
Right.
but isn't it possible to alternate and create kind of a 10 milligram, 5 milligram rhythm?
Yeah, absolutely. Absolutely. This is good to help with the white blood cell count, and especially right now, this is a good idea to err on the side of caution, where if the blood counts have been running a little bit on the low side, it's smart to reduce the dose so that the white count would run in a little bit safer zone. And so it's much better to just go ahead and make that change with the awareness that in the maintenance setting, for these coming months of April and May and June, probably not a whole lot is going to happen with the myeloma if you just cut back a little bit. It's helpful to remember that when we did these trials where half the patients had ongoing maintenance and half of them we stopped the maintenance to see how useful it was. And the patients who stopped the maintenance, nothing happened for the first 9 months or so. If you've been on maintenance, relapse takes a while to pick up, and so actually you're probably absolutely safe for at least 2 or 3 months if you're just making these sorts of adjustments. Probably the myeloma is just going to be fine. And these are the kinds of practical things to talk to your doctor about, okay?
Okay, thank you so much.
Uh-huh.
Okay, Debbie Morelli, would you like to open your line and ask a question?
Go ahead.
Hi, Dr. Durie, Frank Morelli. How are you? Thank you for doing this.
No worries.
Thank you. Dr. Durie, I'm on venetoclax, recently started that therapy along with Velcade.
Okay.
And the suggestion is to transition from Velcade to Ninlaro, not to go into the clinic on a weekly basis, well, 3 weeks on, 1 week off. And I think the efficacy of that is fine. Hopefully it's a short-term.
So you actually, I'm sorry, you received that recommendation already?
I did. Mm-hmm.
Yeah.
I did. And I was just thinking it's probably a good option, or a consideration for other patients that may be on Velcade as a interim game plan as we get through this next few months to have that home therapy as opposed to traveling into a clinic or a myeloma center. Just just wanted your opinion on that as well.
Absolutely, I fully agree. And so this Ninlaro option as a proteasome inhibitor, I think that this is a time where the use of the Ninlaro is really an excellent option. It's by mouth, reduces the number of clinic visits, and then having this concept where you adjust the dosage, where you err on the side of caution, where we're not liable to run into a situation where the blood counts will run low. So, yeah, a good type of suggestion. Thank you. Mm-hmm.
Thank you.
Maddie Hunter has a really good question. Maddie, can you open your line, please?
Yeah. Hi, Dr. Durie.
Hello.
Thank you so much for always being available for us. I heard a presentation earlier today from Dr. Joshua Richter, and in his presentation, he mentioned something called a cytokine storm that can happen at the end of someone's, sounds like not so great experience with COVID-19. Can you tell us what that means?
Yes. So if God forbid someone does get this COVID-19 infection, and goes into this very critical phase where they're having the lung issues and might need to be on a respirator. At that same time, there is what's called a shock syndrome that can occur, which seems to be triggered by something like the cytokine release syndrome that we've seen with the CAR T-cell therapy. And in China, when they had a lot of patients who were developing that very unstable and deep shock syndrome, they actually used the treatment that we use for CRS, including this, I always mispronounce it, tuxilumab, the anti-IL-6 monoclonal antibody, which is actually commercially available. And so using anti-IL-6 and actually steroids at that exact moment, if you use the combination of steroids and the anti-IL-6, you can shut down this shock syndrome. And they did have successful recovery, which was actually good news. So something to keep in mind if that is emerging for someone that you know or someone in your social group. Yes.
Thank you.
Yeah.
Okay, we have a lot of questions. I'm trying to scroll through and catch them all, so I apologize if I'm not getting to them. Tom Tucker, you had a question. Can you open your mic, please?
Yeah, Dr. Durie, you're talking about possibly being able to get out of the lockdown a little bit in June and July timeframe, but
right,
you know, kind of tied all together with that. The reason is, when do you think we'll be able to? When would you expect to start doing in-person support group meetings again?
Right.
And are you planning on doing regional community workshops or patient family seminars later this year, or is that something you're kind of dialing down to?
Well, I mean, I think that we are watching everything just as you all are. I can tell you that we still have our patient and family seminar for August, which is actually in Los Angeles. That is still scheduled, right? And so what we're doing is that we're just staying open on these different things until we see how things go. But we're being influenced by some of the different businesses. Some hotels are shutting down for like 90-day periods, for example. And so we just need to follow along in terms of the logistics of what's feasible. But I think certainly for April and May, we're pretty much in a stay-at-home mode, and as I said on my slide, June, July will be a transition period. If we're lucky, you know, we'll start to be able to move around. Although I do expect that movement around will include some sort of documentation that you're COVID-19 negative or that you've recovered or something. I think that this is going to be a changed world where that might be required, and there could be mandated restrictions against meetings of 50 or more for some time. We don't know.
Okay.
Difficult questions.
Yeah. Can we plan on you sending us your recommendation when we're ready to resume in-person support group meetings?
Absolutely. As you may have noticed, this has been incredibly unique for me. I've been writing about the COVID-19. I did it 4 weeks in a row. I mean, which is, I never done that for anything. And I'm actually doing it again this week. I'll have a new blog. But within that, as you can possibly tell, I'm trying to stay as up to date as I can with these various regulations and plannings and restrictions. And so whatever I hear, like through the grapevine, I will absolutely be letting everyone know so that we can be planning together. We did try to plan ahead so that, you know, we canceled the Boca seminar a little bit ahead. People were even surprised that we took that step, but it seemed from what we knew that that was the smart thing to do to keep myeloma patients safe, which is our #1 priority. we can keep people informed electronically like this, and that may be the way to go for a little bit of time.
Thank you.
No worries. Yeah.
Thanks, Tom and Dr. Durie. That is a good question. I know a lot of you are trying to figure out what to do with your support groups. We have been reaching out to each of you, offering these go-to-meeting licenses that we've had, and John has been giving one-on-one instructions with you. And some of you have already had really successful go-to meetings, and we're going to be able to do those for at least 90 days. The licenses are good, and if we have to continue and do it a little longer, it's all about patient safety, but we still need to be socially connected, but at a distance. We all need to stay in touch with each other. So as far as additional leader meetings like this one, we can do more of these, and we can continue to have your virtual go-to meetings. And if you do need help with that, please let any of the support group team members know, and we'll help you set those up.
Absolutely. I just wanted to say there will probably be always little bits of new medical advice that we can give, and we will absolutely keep everyone posted on if there are new suggestions that come along related to the mask, for example, or how to handle different changes in treatment. We will absolutely be keeping people up to speed.
And just, let's see, we're looking at the time. We've got a couple of minutes left. So before we wrap up on the questions, I just wanted to make sure, as I'm scrolling through and you're looking at my desktop here,
yeah.
This is the one page on all Corona information, videos and updates and blogs that Dr. Durie has been updating quite often. So when he mentioned about the 4 blogs that he's done and the additional blogs that he'll be doing, you can find this all on this one page here. And today we can give you a heads up that we will be having a Living Well with Myeloma call, specifically on myeloma patient safety and the coronavirus. So you can register right here on this website as well. And that's going to be on Thursday, April 16th at 4 p.m. Eastern.
Right.
So let's wrap up with maybe one more question, and it's hard to pick. So please send your questions call the info line. I'm sure Susie will wrap up with that. Nick Manitas, you have a myth or fact. Do you want to open up your line, Nick, and ask? Nick, you're still on mute. If you're available to open your line and ask your question.
Maybe not.
Maybe not. Okay, so we do have some other ones. I saw one from Kelly McAfee up in New York, the Adirondacks. Kelly, can you open your line and ask your question?
Hi, everybody. I was just interested, Dr. Durie, on your insight. I am an elotuzumab patient. I'm at bi-weekly or bi-monthly, and I was interested once a month. What would you recommend?
Right. Yeah, I think it depends on the safety of your center. I mean, we were talking about it before. If you go into the center and you feel really comfortable that it's in a separate area, maybe they have a separate entrance and the staff are well protected, I mean, you can have some degree of a comfort level to go in. But if you have any level of anxiety at all, I think cutting it back to once a month is the way to go. As I was saying earlier, I mean, these modifications are not ideal, but in the short term, for 2 or 3 months, these are possibly the better part of valor, you know, just to stay protected. The number one thing right now is to not get exposed to this virus. And so some of these modifications are not necessarily what we would do under normal circumstances, but you just have to balance your risk and talk to your doctor about it, you know.
Thank you. Thank you.
No worries. Yeah.
Okay, Dr. Durie, any other words of wisdom? And then we can go to Susie as well to wrap this up a little bit.
Well, I think that, as I've been saying, we are here for you to try to keep you as updated and safe as possible. I think that it's really hard. It's a new normal for us, staying home. I'm looking out into the garden. There's lots more time. It's safe and nice in the canyon here. With less traffic, the air is better. And so we need to balance all of these pluses as we try to just hang through these really challenging times. In places like New York, these are really, really difficult times. So many people have been affected, and just so challenging to see people who are so desperately ill. And we need to emotionally support and help everyone. So please hang in there, and we will certainly do the very best to help. Susie?
Hi. So Brian, that was very, very good. And I learned a lot, actually. To say that this is a really a scary time and we're in uncharted waters is I mean, it's just over the top. We're all like wondering when, what's going to happen next? What's going to happen next? But we are strong, and it's okay. Every once in a while, to just, sit down and, I don't know, have a glass of wine or, go punch a pillow to just get the anxiety out. But we're in this together, and we will get through this. And thanks to all the support group leaders and all that you do for so many people all across the country. I can't thank you enough. And please know that, you can email me at snovis@myeloma.org. And I can always flash that under Brian's nose so he can reply, or I can reply for him. But again, this will get through this. We are resilient. We are myeloma warriors, and we're not going to let we're not going to let it get to us.
Very, very good. So thanks, Robin, for pulling this together, and thanks to all of you leaders who sent in questions and concerns. I think it's very, very helpful for everyone to look at those questions and concerns together. So thank you.